I'm always stressed. People I admire most in the modern world, people like Mario, who just never seems to show any stress whatsoever. Bruce Hong, another one. Grant is a bit stressed, a lot stressed sometimes. Maytham, very stressed all of the time. But the difference between stress and burnout, I'm not sure exactly what that is. I think there have been a couple of times when if I haven't been burnt out, I've been very, very close to burnt out. But I live with high levels of stress and somehow seem to cope. Perhaps not that well. Perhaps I don't cope as well as I think I do when looked at from the outside. Professor Renata Schoeman joins us now via Zoom, a psychiatrist, head of the MBA in Healthcare Leadership at Stellenbosch Business School. Renata, good morning.
Good morning, John. Good morning, listeners.
From an emotional, psychological point of view, is there a clear dividing line, or is it a gradation between stress and burnout?
It's a gradation, but I think the important thing is to know that stress is a physiological response. Our body needs to be stressed to cope with certain things in our daily life. Otherwise, we will never meet the deadline, etc. The problem is if the stress is excessive and over prolonged periods of time, and we do not take care of ourselves or put things in place to build our resilience or to recuperate, that then the stress plus the chronic fatigue that we experience due to not resting enough or rejuvenating enough can then continue and evolve into burnout, which is then a constellation of symptoms of depersonalization, emotional and mental exhaustion, and a decrease in efficiency and productivity, and ultimately anxiety or depression.
So stress then is primarily physiological, and burnout is a combination of physiological and psychological consequences.
Yeah, stress is a physiological response, which is a coping strategy, and that's good. Our body needs to be in stress, but not distress. But when it's burnout, it refers to an occupational phenomenon. So it is something that happens in the workplace when you are employed, and it is then a combination of the stresses together with a lack of resources, whether it's time, whether it's cognitive resources, whether it is money, or whatever you need to adequately do your job and have the necessary support.
Now, you are with the MBA program in healthcare leadership at the business school, so there's obviously a business element to this. If you work in a company, you work in a country which is stressed, and you work in a company which is going through hard times, and there are stresses related to that, and your family life is difficult for whatever reason, there are stresses to that. So there are both costs to you as an individual employed in a company, in an economy, but there are also costs, economic costs to you. Perhaps you run out of paid sick leave and have to take unpaid sick leave as you deal with the consequences of your stress, your burnout. There are consequences, economic consequences to the company and to the national economy. How closely, if at all, are these things tracked? Are there statistics available on the economic costs of stress and burnout?
Unfortunately, we do not track it continuously, but there is intermittent studies that is done. And a few years ago, there was a big study that was done where different countries were compared. It was 6 countries, and South Africa came out as the worst off, with the most money lost due to absenteeism and presenteeism. Now, absenteeism is easy to track because someone is not at work or they're booked off, and you have specific days that you can measure and put it into monetary cost. But presenteeism, when people are at work, but they're not performing optimally due to mental health conditions or burnout. So there's this loss of productivity and mistakes that can happen and just working less efficient. Now that is very difficult to track. What we can also track is employee turnover and the cost of retraining and recruitment new people if people leave. I think what is important, as you mentioned, people running out of sick leave, etc., so that individual cost as well. But unfortunately, that's something that we see quite often, that people are booked off for extended periods of time to recover from the burnout. But resting doesn't work for burnout. Rest works for fatigue. When we are burned out, there need to be active involvement. And almost what is ironic, work or being at work is a protective factor against mental health conditions because it can often give meaning to your life.
Okay, I've just looking at a WhatsApp while listening to you, and from Anonymous, suffered burnout and PTSD after excessive bullying and harassment in a toxic workplace, given excessive amount of works in an attempt to make me fail at my job, placed on sick leave. When I returned, the bullying intensified. Doctor put me on sick leave for 9 months. So, I mean, that's not entirely in line with what you've just said, because they're going back to work wouldn't give you a focus, a sense of purpose, because the workplace was toxic. So
No.
this is a complicated area.
It is, but once again, being booked off for 9 months doesn't achieve anything. If there is toxic workplace culture, that has to be addressed. If there is leadership problems, it has to be addressed. If there is imbalance between workload or job description, that is also where occupational therapists, for example, is extremely important to look at workplace accommodations and to match the capacity of the employee together with a job description. And that's also where professionals, healthcare professionals, need to be on board, because I have never had a problem if I pick up the phone and discuss with an employer what is, obviously with the person's permission, what is needed, that they're not willing, because most employers understand that it becomes a little bit of a slogan, but there is no health and no wealth without mental health.
Are there reasonably reliable signs that tell you as an employee, whether you're at a low level in the company, middle management, senior management, reliable warning signs that you are headed to counterproductive levels of stress, which might lead to burnout? You started by saying stress is a necessary response to pressures in our environment. But at the point at which it is likely to become counterproductive and harmful to you as an individual and to the work environment in which you labor, are there signs that are common enough to be able to alert you to something bad coming?
Yes, absolutely. We can group it into a number of symptoms. The first would be your physical symptoms. So fatigue, aches and pains, difficulty sleeping, changes in your appetite, changes in your gastrointestinal symptoms. So there can be a number of physical things. Then cognitive symptoms, increased difficulty in taking decisions, difficulties concentrating. And then emotional symptoms, more irritability, more what we call depersonalization. Please don't talk to me. You're avoiding your peers at work or your colleagues. You don't want to make the small talk. Everything annoys you and irritates you, and you feel completely detached and just want to withdraw. Now, that is quite reliable. Also, then self-medicating. You start to can't wait for your glass of wine after work, which is not necessarily always constructive or actually achieving anything positive. I think what we should also consider is escapism behavior. And I mentioned the alcohol, but what we also see these days is screen time and excessive doom scrolling. Even when people are at work, you're feeling overloaded, but you escape to your cell phone or you escape to different sites instead of being busy. And that in per se also then causes an additional load and inability to cope with what is expected of you. So it's really a constellation of symptoms. But I think if people are really aware of themselves, that loss of interest and drive and withdrawal, and just finding that they have to work harder and harder, but they achieve less and less, that's quite reliable. And I would really try to encourage people then at least to have a conversation with a professional person.
Thank you very, very much indeed. The only one that there's only one symptom there that I didn't think applied to me, which is a little worrying. Renata Schoeman is a psychiatrist and head of the MBA in Healthcare Leadership program at Stellenbosch Business School.